Okay, this is the question from Francesco. So the SALP position, SALP is an acronym that stands for supine anterolateral position. Normally, you know, you don't go in prone, but you go in SALP 30 degree, and the operator follow, you know, using the same approach with ultrasound, same needle. What you do, you follow the medial axillary lane and you perform the biopsy. Normally I do in patient with, as you know, in patient with that are obese, or patient that have, you know, respiratory problems, or, you know, some special, if I have, you know, cysts in the kidney, I try different position to be sure that, you know, I can perform the biopsy safely. So this is where, you know, I prefer to use SALP instead of prone position. I don't know if Dario and Mia have done, you know, SALP.
As I told you before, Tino, sometimes we are compelled to adopt different position of the patient, and so I remember that in some occasions I was trying to perform biopsy in improbable conditions, but what I think we need to emphasize is that this is a very exceptional situation. In the vast majority of cases, in I think more than 90% of cases, if you put your patient that is, of course, a patient that has not respiratory problems, in the standard condition prone with a pillow below his, and you try to have the back exactly linear. In 100% of case, in the angle between the low border of the last the rib and the border of the paravertebral muscle, you have the kidney by sure, unless it's ectopic. And if you have a minimal practice, you are able to perform the biopsy with in the guided modality, in the guided way, in so few minutes that you don't need the patient is completely compliant. So what I mean is that if we have to launch a general message, is to try to have a very standardized modality of biopsy, because of course sometimes you need a physician with particular expertise, but it's very minority of cases. The biopsy should be made by a young nephrologist since his first year of specialization. This is my idea.
But the SALP position can be our standard for obese patients.
In the vast majority of cases, yes. I remember patients with how many was the body mass index of that patient? 40 of body mass.
You know, my best that I did at 220 kilos in Syracuse.
Okay, 20 kilos never happened. Okay. Congratulations.